Hey, it's Lacey. I am clinic director. If you aren't familiar with who I am, I wanted to talk to you today about COVID testing. So here we are about a month in to the COVID situation for Horizon Health, and we've done a lot of changes to our operations since then. One of them is including our respiratory care clinic, where we're trying to send our patients who have cough or other symptoms that could be consistent with COVID-19. When we first started out, we had guidance from IDPH and CDC, which we are still following, but we get a lot of questions from the community and from our employees about testing and how much testing are we doing, is it enough, and should we be expanding that out. So I wanted to kind of visit how we got to where we are. From the initial time frame in early to mid-March, when this started to evolve, we saw two different things. IDPH initially had a limitation in their labs of how much volume they could process at one time. Commercial labs weren't yet processing, or very limited processing of COVID testing. And then from a supply stance, the supplies were very hard to get a hold of. So it was sort of the perfect storm of testing at that point in time, and guidance for exposure from IDPH was it's better to advise patients to self-quarantine if they're not experiencing severe symptoms than it is to test. So as we've seen with many other circumstances in this situation, everything is evolving, and that includes testing too. So about 2 weeks ago, we made a shift in our respiratory care clinic, and so I'm going to pull up a document here that's, this is the CDC guidance on priority for testing. So we were at level 1 before, which is for hospitalized patients, and then for healthcare facility workers with symptoms, and that's in alignment with IDPH guidance too, for what they can process and their labs. So about 2 weeks ago, we made this shift to go to priority 2 inclusion. That includes for long-term care facilities, 65 and older, patients with underlying conditions, so like those who have diabetes would fall into this category, and then first responders with symptoms. And then we're now then getting more supplies in, and then the CDC guidance continues to expand out to say, as your testing capabilities expand, consider broadening your testing options. And so we're now testing then for priority 3. In priority 3, you're basically expanding out to any individual who is symptomatic that would meet the criteria. So you're still prioritizing those who are healthcare workers, those who are part of that critical infrastructure, those who are elderly, but you're also then expanding out to those who are symptomatic from our testing options. So other things to keep in mind with testing, we do have our commercial availability is through LabCorp. If we have someone who does meet the IDPH criteria, it does go to IDPH for processing. That turnaround time is usually around 1 to 2 days. For a turnaround at LabCorp, we see 4 to 7 days. They have gotten a little quicker recently, so that's hopeful. The testing in the media has a lot of questions about antibody testing. Antibody testing is still very limited. Some of the calling around that we did, we found isn't widely available here. We do have a vendor that has told us we may be able to get a hold of that sometime in mid-May, and the potential to offer that in our lab. We also have a point-of-care testing machine that is planning to add antibody testing. That will be available sometime in June for that vendor. So I think we'll continue, just as we've seen in the last month, for supplies and testing to continue to expand and the guidance to expand. I expect to see that to continue for the coming months.